we are now going to move towards the children health. And as you know, that the childrens are the future of any nation, and so is for our country. The session which we are going to have is saving children, saving nation, and there are doctors who are working with a clear purpose of making this happen. Now introduce our panelists. Today we have Dr. Prakash Singh, who is also a soldier doctor. And the theme which we are carrying for last 3 days in our 7-day long gratitude week is that we need to bring about that emotional and social support for our doctors who are working like a soldier for our health. They are our guardian. And Dr. Prakash come from that background also. So he is not only fighting the diseases, he has also fought on the borders. So he is director and unit head of neurosurgery at Max Super Speciality Hospital, Saket. And he has been a doctor with the Indian Army and is a recipient of Vishisht Seva Medal by the President of India. So thank you so much, Dr. Prakash, for joining on this special session where we are talking about the role of our doctors in saving our children from all kind of diseases. We have Dr. Sumit Mrig. He is the principal consultant and head of department of ENT at Max Super Speciality Hospital. He's one of the youngest cochlear implant surgeon in India and Asia, and has already conducted more than 250 cochlear implants in pediatric and adult age population so far. We have our third doctor, Dr. Vikas Dua, is the additional director and head of pediatric hematology, Haemato-Oncology and bone marrow transplant at Fortis Memorial Research Hospital, Gurugram. Along with his team, Dr. Dua has also done more than 200 pediatric transplants and is known for excellent outcome in stem cell transplant. Welcome, Dr. Dua, on this panel.
Thank you, Kamal, for the kind introduction. Thank you.
Before I go to discuss that, what keeps you, all moving on in your profession, ensuring that you are bringing that kind of the health, the boon of health to the children who are our future. I would like to hear some of the stories of the real patient who actually experience that what it means that when you have a certain disability or certain defect or a disease which makes you not live life that in a fulfilling manner. So I have a doctor, a patient. I think her name is Ria. She has joined us today. I like to hear from Ria that, Ria, what was your experience and what happened and what kind of help you got from the doctor? Is Ria there?
Yeah, I think they need to unmute.
Want to say something, Ria?
Yeah.
Good afternoon, everybody. I am Ria Ghai. I study in class third B1.
Do you like a machine?
Yes, I like a machine.
So I think let me add a few things before she speaks. So Ria is my daughter, and myself Rahul Ghai, and I'm a qualified chartered accountant working as vice president with Barclays. So we got to, first of all, I think I need to take this opportunity to thank the godlike creatures on this earth called doctors. So real thanks to you guys, because I think you've been the one who've changed our life and helped us lead a very, very normal life. We got to know when Riha was 2.5-year-old that we always thought she's not speaking, but then we realized that she's actually not hearing. So the world turned upside down for us. So if you realize that we're from a happy-go-jolly family, everything was going fine, and all of a sudden we understand my daughter is not hearing and she'll never be able to speak. I think that was the time when the world turned upside down for us. I think it took us almost a month to realize, is this something we'll have to live our life with, and this is how the new normal would be for us. But then we realized, and we actually met a god-like doctor called Mr. Sumit Mrig, and he guided us. He guided us big time. He first of all educated us that no, these are certain things that can be cured. First, he guided us, yes, okay, take your time, get this thing in. There is an issue, but there is always a resolution to every issue. And the resolution came across in the form of cochlear implant. And I think that's a majestic thing. When I first heard about it, I never thought my child could speak as normal as what I can now. She is now 8 years old. We've been in this treatment for 5 years now, and I can tell you that she speaks everything. She enjoys everything. She goes to a normal school. She can hear everything, right? You can hear everything. You love your machine. Want to say thank you to the doctor?
Thank you, doctor.
Thank you so much, Rahul. It is really wonderful to hear this story of, a real story when when you discover that maybe God might have not given something which you can get sometime from a doctor. And I really salute all those doctors, including Dr. Sumit, as we can see the wonder you have achieved here. But at the same time, also all those people who work hard in even finding out these technologies, those who brought these technologies, those who innovated these technologies, and the doctors who have brought and made sure that the technologies are put to the right use for the right person for the right time. So thank you so much. I think we have one more patient with us. So before I go further on our talk, let's hear her experience as well.
Hello.
So Insha,
Good
that's how you
afternoon.
pronounce your name?
My name is Insha. Good afternoon.
Hi, Insha. Yes, good afternoon. So please tell us how did doctors help you, and what was lacking actually. So
Dr. Vikas is a very, very nice person. He is very calm, and he always treats his patient like his children. And वो हमेशा से सबको बहुत अच्छे से ट्रीट करते हैं, और कोई भी बच्चों के पास जाने में कभी भी हेजिटेट नहीं होता कि जैसे पेनफुल इतना पैनिक ट्रीटमेंट में.
Dr. Vikas, what was the
I can
conditions
add
he
on to
was?
that. So Insha was diagnosed at the age of 11 years with acute lymphoblastic leukemia, which is a type of blood cancer, and that too was a high risk. So we characterize blood cancers into standard risk, intermediate risk, and high risk. And she had a stomy course at the beginning. She was given chemotherapy. The family met us for the very first time. They were staying in East Delhi, and we were actually in Gurugram at that point of time. So they traveled all the way from East Delhi to Gurugram, and you can very well understand when a child is being diagnosed with acute lymphoblastic leukemia, and you disclose for the first time to the family that your child has a blood cancer. So what sort of things go to their mind? So they came to us. She underwent chemotherapy, and the journey was not very smooth. Initially, she had quite a number of ups and downs, and the therapy lasted for almost 2 years. And it's been 3.5 years post completion of therapy. Insha is doing well. She is in class 10th, living a normal life. She's a dancer. She dances very well, and that's how her journey is all about.
Thank you so much, Doctor. So, Insa, you are a fighter yourself also, and you have done wonderful, and I'm sure you will have a great future, going forward. And thank you so much for joining to share your gratitude for your doctor. But as the doctors are going to help you, you also need to help yourself and keep, looking for better in your life, because whatever impediments will come will definitely be somebody will be there, the doctors, so many people who will make sure that all your impediments are removed. So wonderful, and best of luck for you for your very bright future. We have one more patient, and then we quickly go to the our discussion. So bear with us, doctors. This is a gratitude week, and we want to see the real stories of people who have experienced the that there is somebody after God who can help them at all kind of misfortune or in bad times. So can we hear the the other patient? So let me then quickly go to first to Dr. Prakash. He a soldier doctor, and I'm sure right now he's taking care of a lot of patients. May not be on the front line of Corona fight, but at the same time, Corona is not the only problem our country is facing.
Tuberculosis also sometimes causes infection in the brain, and therefore it also results in hydrocephalus. So that how we treat. There are certain other congenital conditions of the spine, which if not treated properly will cause a lot of morbidity to the children. If they are properly treated in time, their life becomes, quality of life becomes better. Then there are patients who get some brain tumors in children, and that is the one we treat. In addition, we also treat trauma to the spine and the head, which is also quite common. So these are the few conditions which in the children which we treat neurosurgically.
Thank you so much, Doctor. You are actually treating some of the very I think critical conditions, and they can definitely be either cause disability or can cause sometimes fatality also. So wonderful. I think our other patient has got the audio fixed. If they have already got the audio fixed, can they share their experience?
By birth normal थी बिल्कुल. She is a normal child. At least 2 years before 2 years इसको fever हुआ था. तो इसकी पेरेंट्स मीटिंग में मुझे इसकी मैम ने कंसल्ट किया था कि ये अटेंडेंस का रिप्लाई नहीं देती. देन हमने कुछ नोटिस किया कि इसको हियरिंग प्रॉब्लम है. आफ्टर देन हमें फिर डॉक्टर सुमित मृग से मिले. इसका हियरिंग टेस्ट हुआ, बैरा टेस्ट. देन डॉक्टर सुमित ने इसका सर्जरी की. ही इज अ वेरी गुड डॉक्टर. ही इज वेरी कोऑपरेटिव, वेरी सपोर्टिव एंड वेरी फ्रेंकली विद अस.
तो ये
माय चाइल्ड
बच्ची अब सुन लेती है अच्छे से.
Yes, she is doing very well.
And she is
now she is बिल्कुल normal child की तरह behave करती है बिल्कुल.
And she is doing good in the schools also, no? In her study and everything. Thank you.
She is doing very good.
Wonderful. What's her name? Ishika.
नाम बताओ अपना. बोलो.
हाँ.
बोलो.
Thank you.
My name is Ishika Gupta.
Thank you, Rishika Gupta. Thank you so much for joining. So I think these are the purpose of showing these and talking to these case study was that I think these are the joy which keeps the doctor moving. This is where you start sometime feeling that, okay, if I can't get something from God, there can be somebody who can help me on this. And to all our three panelists, today's session and the whole gratitude week is to find out what are those what are those traits, what are those feelings which made you become a doctor, and then go forward on your specialties, and what keeps you keep moving on that line. Since we spoke to two patients of hearing impairments, Dr. Sumit, what this problem is, hearing impairment. There is one who was fine by birth, so apparently God did not leave any gap, and then the diseases did something which was disastrous, and I think apparently what she's saying that it was an infection which might have led to this kind of hearing impairment, while we see the other patient where by birth there was some gap, and it is you can only complain or lament that you haven't got or God did something which was not enough for you. So in both those cases, what is this problem and how it is impacting our children? Because that is what can be a very disastrous for their future. Their whole life can be not complete.
Yeah. First of all, Kamal, thank you so much for running this lovely ISW Council Gratitude Week. In fact, I have never seen such a vast, extensive Gratitude Week running for about close to a week. And I have been in touch with a few of the sessions, just trying and logging in and logging out through my busy schedule. I think I must congratulate you and your entire team. You are coordinating with top surgeons, top anatomists, physiologists, and policy makers, politicians, bureaucrats, technocrats. So, and thank you for giving us the platform and the platform for my patients. These are not my patients, they are my children. I said I have now 308 children. They are my children because they are all my cochlear implantees. I don't treat them as my patients. They are our families. And unfortunately, this problem of deafness is very vast in India, and it is all across the world. And India is no different from that. If you see, as you rightly said about the birth rate in India, that's too high. Every year, about 25 to 30,000 children are born deaf. This is mainly a genetic problem because of some genes which get manifested, and when a child is born, he cannot hear. Although if you can go back to Mahabharat, where Abhimanyu could hear everything in the womb of his mother, because the cochlea is generally the hearing organ of our body. It is mainly functional, but he couldn't hear the complete story of entering into the war zone and getting out of the Chakravyuh. So the cochlea is the main organ which is generally responsible. That's the engine of the ear for collecting the sounds, the external sounds, and processing it and sending it to the brain. Now, we have chosen these two kids, lovely kids, Rishika and Ria. Both of them are very dear to me, and I'm very happy that they are doing excellently well, and they are into the society without any boundaries, without any limitations. And I feel pride in seeing them. Uh, but if you see, Ria on one place was born to absolutely normal parents, Rahul and Sanjana. I know them, and I still remember Ria's mom Sanjana was completely into tears when they came to know after the result that the child cannot hear. So her first question was, why me? Why us? Why my child? And I kept on consoling her and trying to explain that this can happen to any individual on this earth, and this is something related to the genetic makeup. But then Rahul, he has been always the front leader in the family. He has taken some good calls, and he and his wife took some time to understand the problem, but they were quick enough to take a call for the surgery, where I explained them. Luckily, we are in the era of technology, where we have reached the moon, with the Mangalyaan, and so has ENT been completely revolutionized. Um, Trust me, children who were born before 1990, born deaf, they couldn't get this technology of cochlear implant. But cochlear implant started in about 96. It is called as a bionic ear organ. So in case of Ria, the problem was that her eardrum was fine, her ear bones were okay, but the processing place called as a cochlea was not functioning, and the nerve from the cochlea to the brain was also okay. So we have a technology, what we call as a cochlear implant, where we have an external device and we have an internal device. So you can see what Ria is wearing on her right ear there is an external component, what we called as a processor. It is just like a hearing aid, but then it is much more advanced than a hearing aid. And through a surgery which lasts for about 2.5 hours, we place an inner implant which goes into this spiral structure called as a cochlea. So the electrodes go inside the cochlea, and the sound signals are transmitted from the external processor to the internal component, and the electrical signals are generated, which generally go to the brain as sound, and the child hears. So it takes about a while, because these kids who are born deaf generally need about 3 to 6 months, or sometimes even an year of speech therapy, because it is the day one when they get the implant activated. And this is where, if they get a good speech therapy, a dedicated therapy, and I must tell you, full marks to the parent, 100% marks to the parents, to sensitize the requirement of AVT therapy. It is not like a normal speech therapy, which is done for stammering, which is done for stuttering. It is a special therapy called as auditory verbal therapy, where they are taught to hear from the basic things. And I'm happy that Ria is performing excellent in the school. She has won many awards. She is doing into recitation, she is into dancing, she's into singing, she's into swimming. And of course, with great hard work, they have gone back to their life. Now, on the other hand, if you see, every year we have about 25 to 30,000 patients born deaf. But on the other hand, we have patients like Rishika, where a child is born normal and everything is going fine, but suddenly a child can get viral infections. As you know that, fortunately, now the medicine has advanced so much that we have a lot of medical treatment available to most in the urbans and to almost few in the rural. So they can get the infections treated with good antibiotics, vaccination. The immunization program is very robust in India, but still, I cannot give you a count, because what we see in deafness is the tip of the iceberg. And what we don't see is what lies underneath. Patients like Rishika, where the family is satisfied that the child is hearing, the child has started to speak, but you never know, some viral infection may actually affect the cochlea, the hair cells in the cochlea, and the child started to lose hearing. And in a matter of 6 months to 8 months, the child who was absolutely lively, speaking, hearing everything, became completely deaf. So I would again like to, thank the parents, Sachin and Shweta. They are from a place, Tarau in Haryana, and they realized that. They got the test done. They got convinced with the factor that my child needs a cochlear implant. And let me tell you, Rishika is a bilateral implantee. She is wearing 2 implants on both the ears. And in a matter of about 1.5 years, she has done fantastic. They are back to their normal life. I can see Ria is showing a painting she has made. So you see, these are normal kids. In fact, I would say that they are even brilliant in some of their skills. And every time I speak to them, every time I talk to them, they bring tear into my eyes. And so cochlear surgery is a boon. And fortunately, in our country, thanks to the Ministry of Social Justice and Empowerment, that it is done in government hospitals, in private hospitals. I started my program in private about 10 years back, and I was one of the youngest cochlear surgeons. And at that time, it was quite expensive, but now the prices have come down. I'm really happy and glad to see all the beautiful paintings she's making. And it's making me feel proud of the fact that she's back to her normal life. And but then we need to be adverse to the fact that, you can treat this, but if we get these patients on time. So the family is to be very, very supportive. And let me tell you that in this era of technology, every child who is born deaf can be tested by a simple test called as otoacoustic emission, and which can be done on day one of birth. In fact, I am an executive committee member of Cochlear Implant Group of India, a national body who looks after the cochlear implant committee and the surgeries and everything. We frame guidelines for the various surgeons in the country. And just before Corona, on 3rd of March, I met our Honorable Health Minister, Dr. Harshvardhan, and we are in the process of getting this national immunization program and integrating it with the National Universal Newborn Hearing Screening Program. So that like a child who is born gets a BCG vaccination at birth, should get this Universal Newborn Hearing Screening Program, which is to be implemented through the Center all across the India. It has been implemented in states like Gujarat, Rajasthan, but unfortunately, when we met, the Honorable Health Minister was very keen. We had a very good meeting in the Nirman Bhavan, but the Corona completely gripped us, all of us. So I'm sure once we have this universal newborn hearing screening program implemented across the country, there will be testing at district levels, at sub-district level, at villages level, so that this problem, if we can diagnose at a very early stage, at the newborn stage, the results are going to be fantastic. Because
Thank
these
you so
kids
much.
can, yeah,
Yes,
because these kids can get surgery done, and the early we do the surgery, the results are superb.
Yes, so this is very important, and we in the last 2 days also we have been hearing some of the doctors who also said that while the society need to be gratitudeful and thankful towards doctors, sometimes doctors also need to be thankful to their parents, the patients, and that's what you also highlighted, the same emotion that the parents in these case cooperated, they understood that there is a problem, and they followed what treatment was being suggested to them. So that's wonderful. Also, I would like to highlight the point which you said, that these are not your patients, they are your children, and that's what I think the Prime Minister Modi also in his tweet on National Doctors Day highlighted, that doctors are like mothers. They give you that care, and mostly the selfless care, try to get back to you, go beyond any impediment which you face physically, mentally, or psychologically. Let me go to Dr. Dua now. Dr. Dua, so Dr. Sumit said that there are some, 25, 30,000 children who are born deaf. And that's where Dr. Sumit is bringing his expertise and these technologies to help many of them get out of that. What you are treating children who have got cancer, or many similar problem. What is that number and how it is happening? Are they all by birth, or they are also because of the overall NCD being increased on our society? What is that, and how do you bring that kind of care to them?
At onset, thank you, Kamal ji. I hope you can hear me.
Yes, yes.
Yeah, thank you for making me a part of this gratitude week. And let me tell you what I do. I am a pediatric hemato-oncologist and a bone marrow transplant physician. So I look after children who have blood disorders, not just blood cancers. I look after benign hematological disorders. I look after cancers, whether it is a liquid tumor, a solid tumor, and I do bone marrow transplants. So answering to your question, so let me tell you, the number of pediatric oncology cases are increasing day by day. If you ask me, what is the percentage in terms of how many pediatric patients enter a cancer center? So if you see, out of 100 patients who enter a cancer center, 3 to 5% are of pediatric age group. It's not very common. So out of 100 patients who are entering a cancer center, 3 to 5 would be of pediatric age group. When I say pediatric age group, that means those who are less than 18 years of age. So it's not a common thing. But over the last couple of years, the number of pediatric cancers are increasing day by day. That the reason may be, or probably the people are more aware of it. Previously, people were not being diagnosed. The facilities are getting better day by day in our country. Probably that might be the reason, or might be the incidence is increasing. And the second thing is that what Dr. Sumit was pointing out, that their patients have genetic problems. So pediatric cancers are not genetic. So if you have to ask me, what is the most common cancer in pediatric age group? The most common cancer in pediatric age group is blood cancer. And among the blood cancers, the most common blood cancer is acute lymphoblastic leukemia. So acute lymphoblastic leukemia is not a genetic disease. Though it is happening in pediatric age group, though it is happening to even to a very small child, we have seen a 1 month old baby having blood cancer. It's not a genetic thing. So why it happens, nobody knows. But we have treatment, we have cures. So as we speak, on 3rd July 2020, 90% patients do well. So the OS, or overall survival, for patients who have blood cancer is around 90%. And that's just by chemotherapy. Just 5 to 10% are unlucky kids who have relapses or who have issues during therapy. but 90% do well. So the answer to your question is it's not a genetic disorder, and the prevalence, the number is increasing day by day.
So the number is increasing, and the bad part is that we don't know what is actually causing it. But at least the good part is that there is a some kind of management available, some kind of cure is available, and you are saying that most of them, once they are diagnosed on time, are able to come out of it, or being managed in a manner which is much more helpful in continuing the normal life. Dr. Prakash,
That's the most important thing. Timely diagnosis for these kids is very important. Timely referral to a center where there is a pediatric, there is a dedicated pediatric hemonc team there, where you have a dedicated cancer center, you have a pediatric oncologist over there. A timely referral is important, because you never know when things start deteriorating. So if you start the therapy on time, you may be able to achieve a good cure rate.
Wonderful. Dr. Prakash, so you mentioned about certain neurological disorders which are happening among the kids. But what is the volume of that, and what are the risk factors children have, and why do you feel that curing them is important? Because I think that is the life which has just started, or has a huge potential for the country, for the nation. And as I said, they are nation's assets, and
Yes.
taking care of them is the most important aspect. So, Dr. Prakash.
Okay. It's important because the child brain or nervous system grows in the initial 3 years. And if that time it doesn't get appropriate environment for its growth, it's a lifelong disability. So it is important that these conditions are treated in time and prevented. For prevention, we need to have, which we have in the country, a good antenatal program, so that when the child is in the womb, there are certain conditions which could be avoided. A mother has to be instructed properly, so that some congenital anomalies doesn't occur in these children. That is one. Secondly, if despite that they occur, in that case, they should be picked up early. And clinically, they can be picked up, but to diagnose, we need investigation. So today, investigation which is available is CT scan and MRI. Unfortunately, CT scan is very harmful to the children's brain. So they should not be exposed to CT scan. At times, we find patients, young, who come with a CT scan. So we should preferably do MRI. So this needs to be inculcated, or should be make awareness in the society as well as in medical setup, that don't expose young children to radiation. So it will prevent damage to their nervous system, which is very delicate at a young age, and they don't tolerate radiation well. We don't do any CT scan till the age of 5 years in the children. Prefer MRI when required. So that is one. Secondly, if certain condition which still happen, then they must be treated at right time, so that they don't cause permanent damage which become irreversible. So that morbidity will remain, and those surgical treatment are much better today. The technology has improved so much that neurosurgical problems, though they cause a lot of apprehension in parents, and because of the disability, as Dr. Sumit said, that the family is devastated the moment they hear that there's a neurosurgical problem to a child which they love so much. But with today's technology available, everything can be handled fairly well. So the damage can be reduced, and the outcome can be much better. Another thing which is a trauma, which is young children falling from the cot, table at home, and even little grown-up children driving vehicle and all. So these are devastating injuries, and they will have permanent effects. So we need to have that the children are looked after very well, and avoid those traumas, make home safe for the children. There are a lot of things which need to be done, but which is probably not possible all across in the country, in all families. Sometimes because we see so much poverty, the mother is working, the child is left to his own things to do, so they have injuries. So these are the preventive aspects which we need to look into.
Doctor, we have also seen, so you mentioned about that, sometimes the things are, developmental issues or maybe, by birth. But as you mentioned, there are huge number of cases coming or maybe coming. I just, anticipate, but you may be giving the right kind of picture on it, where the trauma, the injuries, some kind of those incidents are happening or accidents are happening which are leading to do this kind of problem. What is your opinion on that? How much of it can be avoided, and then how much of you have been able to mitigate it in terms of after the case has come to you, and you have been able
See,
to deliver the good result? Because every
Yeah,
time a parent will discover or will see an accident has happened, they will come to rush to the doctor. They will feel that, okay, now the doctor, once you reach to the doctor, this thing will be cured.
any trauma, the basic principle is prevention. Whether it is in the due to road traffic accident, whether it's at home, or whether it's a battered baby syndrome. Sometimes everybody has different temperament. The home environment is there, then child is unprotected. Parents sometimes lose temper, they bash up the child so badly that we do see cases who come with battered baby syndrome. So they are devastated. So for that, I think social movement should be there to educate people. The children's brains are very tender, the bodies are very tender, and so there should not be any physical violence on the child. That is first thing. In brain injury, unfortunately, there is a primary injury which occurs because of the direct trauma, and there are certain secondary events. We can prevent the secondary events that there is no further damage take place. But whatsoever has been damaged by the primary insult, that only can cover up over a period of time or may leave some residue, whether it's in physical disability or some intellectual cognitive disability. So our role becomes to reduce or take care of secondary damage, and then it needs a rehabilitation program to recoup whatsoever you can recoup. Because children generally do better than adults because their brain is growing. So central nervous system of the brain has got that capacity that in young people it does well than it do in elderly people.
Thank you. So now I'll go to the second part of our discussion. It is about what actually made you guys to think of this medical profession, and also why you specialized in what you specialized, and what was the driver, and which is now still keeps you driving towards achieving more, saving more, when it comes to life, bringing as many smiles as possible to the people. May not be all the time. We can't expect 100% outcome every time, but I'm sure you all are also treating a age, a target group or a patient group who have very high expectation. And when it comes to children, the parents who are bringing them to you, whether it is for something which is a birth defect or something which is the trauma, the expectation is very high, and then the emotions are run very high on that, and that leads to a lot of other pressure also on doctors. So I'll go to Sumit first. And Sumit, what actually made you to select to be a doctor, and then that too an ENT expert, and then go ahead with the I think the micro specialization of being a cochlear transplant expert? You are on mute, Sumit. Okay.
Kamal, thanks. Lovely hearing Dr. Prakash. In fact, we are both in the same hospital, in the same campus, and it's been a pleasure working with sir for the last about 4.5 years. He's a thorough gentleman, and always love interacting with him. And the story is quite long, but I'll just cut it short for this one. I used to play a lot of cricket during 9th and 10th, and I was completely into sports. Although I come from a family of doctors, my maternal uncle, aunt, my cousins, they are all doctors. We have grown in their nursing homes, seeing my aunt, we just lost her about 10 days back. She was a gynecologist. My uncle is a physician. And so you can say that the seeds were sown, but it was not up till 10th, class 10th, where, I was completely into game of cricket, and I was selected under 14 in the national stadium, selected for county cricket. But I met, we saw some wrong things being happen there. And this is when I decided to get back to studies. And I thought that in that time, parents only gave you the option of becoming a doctor or an engineer. And I think the ball started rolling during my senior secondary school. And I always wanted to be a doctor and a surgeon. So I, after 12th, I couldn't get into the first chance into the medical school. So I dropped it because I was very passionate about becoming a surgeon or a doctor. And I got into University College of Medical Sciences. I did my graduation, and then I gave for my post-graduation exams. Honestly speaking, I never wanted to be an ENT surgeon. I always wanted to be a plastic surgeon, because I thought that it was a great branch where people could actually do aesthetics and cancer aesthetics, reconstructive surgery. So I thought, yeah, I picked up ENT, and I wanted to do MCH plastic surgery, because ENT surgeons are also, they can do MCH plastic surgery. I didn't like general surgery quite a lot, and didn't want to undergo that, extensive trauma of general surgery. So I thought I'll do my MCH from CMC Vellore. And, so I got myself into Maulana Azad Medical College. I think that was the best thing which happened to me, which actually paved the way. And thanks to my teacher, Dr. Arun Kumar Agarwal, and he has been a father figure to me. He still is. And so I got into interest into ENT. I joined ENT only because I wanted to do plastic surgery. And my thesis topic also I selected in plastic surgery. And I was actually called a plastic surgery resident rather than an ENT resident. I used to work more in plastic OTs. And I never had an inclination into ear. In fact, ear is such a complex organ, I can tell you, that it is of the dimension of even just the tip of your fingers, that it is difficult to think about something like a cochlear implant into the inner ear. I couldn't even understand about the anatomy of the middle ear. But as you say that, when destiny is destined for you, you start getting your interest. So I became the in charge for the temporal bone dissection, and this is where I got to dissect few cadaveric bones, and I really got my interest into cochlear implantation. In fact, I am the founder resident member who started CI program on a regular basis at Maulana Azad Medical College. And thanks to two of my teachers, one is Dr. Milind Kirtane, who is the father of cochlear implant surgery in India. He is at Hinduja Hospital. He has been a great inspiration story to me. I used to travel to his place and to see him operate. And the second, so one was an inspiring teacher. The other was who let me grow, which was Dr. Arun Kumar Agarwal. He realized my talent and never stopped me. And I can tell you, I was one of the youngest cochlear implant surgeons. And I came into this, and I completely love my branch. I love the smile on the face of these children, the parents, who come with absolutely, they are disheartened that their child cannot hear. And I'm into 10 years of being the director of CI program, operated about more than 350 patients all across the country. Now I'm into training of surgeons across the country and across the world. We have started about 14 centers, and we have started cochlear implant program in Africa as well, providing training as well. So it has been a completely roller coaster journey. And my gratitude to all my patients, my teachers, my colleagues, my team, my audiologist, my therapist, and most important, my family, my parents and my wife. And, they have been rock solid support to me. Trust me, Kamal, there have been times when I have been doing camps in the interior of cities in Punjab, Haryana, Uttar Pradesh on 26 Sundays in an year. So I hardly used to stay at home, because every Sunday we used to have a deafness camp in a locality where we used to detect deafness, because the newborn screening program was not that robust. And I have spent hours and hours and days of you know doing this testing with my team, and I really thank. And I'm glad that now cochlear implant surgery has become a common surgery. It is accessible to most of the deaf children in the country through the government program, through the private program. And I love my branch. I just love it, And every day I always follow one single motive, that getting up in the morning, if you feel that about for a week, that where am I going, then I think we need to change our job. We need to change our profession. But I every day, 7 to 7 days, I feel that I have a lot more to give back to the society. And these kids actually have given me such a wonderful satiety, such a wonderful satisfaction, that I just feel like treating deafness beyond boundaries, and beyond every human being. So I'm into also adult cochlear implant program. Now we are running the geriatric cochlear implant program, because they are also a neglected part of the society. And we have some wonderful stories of adults being neglected, being depressed because of losing their hearing. And now we are quite a lot of patients we have done, and quite happy to continue so. And thank people like you, who give us a platform to share our views, our emotions, our expression. And the patients, they have to understand that every doctor, like Dr. Prakash said, these kids, the surgery is costly. It in a private sector is cost somewhere about 7 lakhs. It can go up till 24 lakhs depending upon what implant you choose. So the stake is high. The uh, the limitation, the outcome, what they want, the pressure is high on the surgeon. But I always tell my patients that I will just do my best. And just with the name of God and the trust in the God and myself, I've been going through.
Thank you so much, Sumit. It's a good journey. It seems that you wanted to be a cricketer first, but I think the children had a better destiny that you decided finally to become an ENT surgeon. I'll go to Dr. Dua, because Dr. Dua, you become an oncologist, and then you also the pediatric oncologist. Cancer is a terrible disease, and I think families, person, whomsoever get to know about this disease, once they hear it, it's completely a devastating information. That's a different thing, that gradually, since the treatments are available, but it is never a pleasant, it is a never acceptable information for anyone to hear that they have a cancer. And that, I think that's very dreadful to go to an oncologist for anyone. You will be happily going to a gynecologist, you will go to a ENT expert, and to a physician, uh, but going to an oncologist is dreading experience for anyone. Why you decided to become an oncologist, and what is the what is that keeps you going, and then work more on pediatric oncology?
Thank you, Kamalji. Okay, so my story is totally different from Dr. Sumit's story. So we didn't have even a single doctor in our family. I was the first person to become a doctor.
Your voice is still not very.
Okay, can you hear me now?
Yeah.
Am I audible now?
Yeah, you are better.
Okay. I'm saying that my story is totally different from Dr. Sumit's story. So there was nobody who was a doctor in my family. I was the first person to become a doctor, and I don't think even now somebody would like to become a doctor after seeing a struggle what we have gone through. Okay, so I joined medical school because my parents wanted that, to be very honest. At that point of time, my parents wanted me to become a doctor, so we gave entrance exam, got into MBBS. And till the time I was doing my pediatrics, I did my MBBS and MD pediatrics from PJMS Rohtak. So I gave my medical school exams, got selected in Rohtak through All India, and then I entered into pediatrics. I did pediatrics for three years. So when I was in third year pediatrics, at that point of time, I realized, what am I doing? Do I really want to become a doctor, or should I change my life? At that point of time, there was nobody in our hospital, in our pediatric department, who was actually looking after patients who had cancers, who had I would say leukemias, and we were actually referring those patients to Delhi. So Rohtak is quite near to Delhi, so it's hardly 65 kilometers from Delhi. So at that point of time, we were referring all the patients to Delhi, to all India institutes, or some patients who were actually going to PGI Chandigarh. I'm talking about way back 2005-6. So at that point of time, I thought, why don't I entered into this specialty of pediatric hemo. So when I searched for that, there was no DM program in pediatric hemo at that point of time. There was I think there was just one center, and that was PGI Chandigarh, which was offering DM program, and there was just one seat in that. So national board started their fellowship through national board program at that point of time, and I got selected in that. I got second rank in that. I took Gangaram Hospital, and I joined Gangaram Hospital as a fellow in pediatric hemo. So I spent 2 years in pediatric hemo, and then when you at one point of time when you were in Rohtak and you were not able to manage those patients who were having blood cancers and bad cancers, and you were referring them, and coming to a point when you were seeing these patients getting cured and living a normal life. And when we were in Gangaram, we saw patients who were treated 10 years back and living a normal life. That actually kept you going, actually, I would say. And then at that point of time, so the number of pediatric hemo doctors were also very less. I'm talking about 10 years back. So the number of pediatric hemo doctors, I'm not talking about general medical oncologists or adult hematologists. I'm talking about the pediatric hemo people. The number of pediatric hemo doctors was very less at that point of time. And there were a handful of people who were actually trained in pediatric transplants. So when I completed my pediatric hemo training from Gangaram, so I thought, why don't I enter into pediatric transplants? Because the number of patients who actually need transplants are very many, and you don't have pediatric transplant patients. So there are conditions like thalassemia. So India is the thalassemia capital of the world. So if you ask me, a thalassemic patient would require monthly blood transfusion from the age of 6 months. So these patients were actually getting blood transfusions throughout their life. But the permanent cure was bone marrow transplant. And at that point of time, there were very few centers who were offering transplants for thalassemia. And there was just one center who actually had well-trained transplant division, that was CMC Vellore. So people used to travel from Delhi to CMC. So that at that point of time, I thought that, why don't I enter to pediatric transplant? And there was no formal pediatric transplant training in India at that point of time. So I had to move to Singapore. So I stayed in Singapore for 2 years. I did my pediatric transplant fellowship from India. And when I came back, and it's now we have done more than 250 transplants, and when you see patients of cancers who had at one point of time no hope, and you bring hope to their lives, and when you see the smile on these kids and the families, so that actually keeps you going.
Thank you so much, Dr. Dua, and interesting that you are moved by something which is becoming a major concern for the country, and then, as you said, that we are becoming a thalassemia, or we have become the thalassemia capital of the world. So important to take care of this set of patients. Dr. Prakash, your story is definitely going to be much.
My story is probably more like Dr. Dua's. Nobody doctor from the family, but my brother sort of decided for me that you will take medicine. So after our pre-medical, he said, select biology and then get into the medicine. So we went into the medicine. My friend, after doing graduation, was interested to join Indian Army. So he said, we'll appear in the exam. Unfortunately, he didn't get selected and I got selected. So I joined Indian Army as a young. And then got an opportunity to do surgery at Pune. Did surgery, and then got another opportunity to get super specialization. I was more interested as a general surgeon in doing urology, but somehow I think it was destined for me to become a neurosurgeon. The things happened that way that I got neurosurgery. I'm very thankful to Professor Kak, who was heading the department at PGI Chandigarh. who took me under his umbrage and then trained me very well. And after that, I think it is how you grow up. It depends on how you take a challenge. My personal experience is that if you take challenges very prudently, then you are going to be successful. If you chicken out in surgery, then you will not grow. But if you are, you don't do it prudently, then you mess up things. So my basic I think instinct was do no harm. That is a basic principle of medicine. It is has been said by father of the medicine. The first principle is do no harm. So I think it stuck somewhere in me that whatsoever I'll be doing, I will not chicken out, but at the same time, I will not harm with my knife, that if you use it in such a way that your patient is get harmed. So that is what. But accepting challenges was a thing which let me grow. And God was kind that things have been very good. And what drives me is that when a patient comes to you in the OPD after surgical treatment, his relatives or patient himself is very happy. He's relieved of his suffering. Neurosurgery problems are such that they are devastating. We are the last hope for them because the medicine doesn't work. Similarly for surgery, why I went to surgery initially was we had seen during training that there's a point up to which the medicine can treat, and beyond that surgery takes over. So we had seen those things. Look, no, it's not the final thing. The final thing is surgery, and many things can be treated by medicine, but there are many things which cannot be treated by medicine. So I think that led me to surgery and then neurosurgery. And probably it's my attitude that accepting a challenge and not chickening out is what brought me here, where I am today. And I think probably it was destined, and God is kind, that things have been good so far, and I have been able to contribute in reducing the suffering of children who suffer from neurosurgical problems.
Thank you so much, Dr. Prakash. I'll go for the last round of remarks from all of you, and this is about that because one of the reason we planned this Gratitude Week is also to bridge this growing trust deficit between patients and doctors. And this trust deficit many times comes because a lot of those perception which are built or the news which come, and this trust deficit or the dissatisfaction also come from, I think, the over expectations from medical professionals and doctors. What is your message for them, and what has been your experience about that aspect where somebody, because everyone who comes to you, as I said, that it's a very high risk and a high stake thing for them. It is
Yes.
a very big emotional trauma. Once they bring and enroll in the patient in your OT, they will expect that you will bring back and you will ensure that the life will continue, and
Okay.
which might have not been a case always.
Yeah,
So how do you deal with that?
That's true. I think we have to be realistic while briefing these patients when they come. What is doable, what is achievable. So that is what is there, and to be realistic. I know that patients have very high expectation at times, and which always doesn't translate, the result doesn't translate as per their expectation. So it is very important for us to have a realistic assessment of the situation and explain them. If they accept it, fine. If they don't accept it, it's their choice. Trust deficit has been, I think, over a period of time, once medical profession was put into service by law, I think it has grown. And to an extent, it is overdriven by media. And that is why this is there. We had seen big heroes criticizing medical profession for no reason and rhyme. There may be some aberration. Those aberration has to be investigated and addressed, but not to generalize it. The generalization of this aspect has caused challenge between the patient and the profession. I think it needs to be addressed at a much larger platform. The society has to realize what is achievable, who's doing what. And I do agree there's a trust deficit, but I generally find in my own thing much less. But there are people who are very emotional. They want everything to be done, or every result to be the way they expect it. It's not possible in medicine. Medicine is just not science. It's not 2 + 2 4. It is an art also, and there are limitation of the medicine, surgery, and the doctor himself. So certain things, I think probably God has kept to himself. I think that's how we should look at it.
Wonderful. That's what one of the session which we had, that should we consider our doctors gods, superhuman or human?
No.
I think we should consider our doctors human, and who have the skills to serve the humanity, to save the humanity. But it cannot go beyond that. We should always have that there is a limitations for everyone. Dr. Sumit, you said that you are dealing with the patients again, very, very high expectation group. And once you say that there is a technology, and you have also talked about that there's a cost, and the cost sometimes is very high. And so double stake are involved in that. What happens if the results are not in line with the expectations?
See, Dr. Prakash has very well summed up. I would say that the onus is not only onto the doctor, it is onto the society as well. We are like the real partners, the patient comes to us with a hope, and he always think a doctor is there to fulfill that. But then I think case selection is the most important thing. What you are selecting, are you capable of treating it or not? Number one. Number two, how you think that you can be, you will be able to fix that patient. You will really be able to provide that. So maybe a realistic expectation has to be presented. That expectation has to be understood by the parent. Now, like in my branch in cochlear implant surgery, my job is just the 10% of the 100%, just to do a good surgery. But the 90% of the job is post-surgery rehabilitation. Now, that rehabilitation onus is onto the therapist and onto the parent. So you have to make them understand that my job as a surgeon is only for 2 days, that I'll admit the child, I'll do a good surgery, the child will be discharged. But after that, the real struggle starts is how to get that therapy. So I would say that, yes, nowadays, the family, they spend money, they spend a lot of money, but they want quick results. But you have to understand that everything has got a cycle. You need to invest time also to get that result. Now, you are absolutely right in saying that there has been a mistrust. Of course, there is a mistrust not only in the medical profession, but in all the professions you see. And of course, media has highlighted that. I just ask you one question, Kamal. When has it happened that a patient has been treated by a neurosurgeon or Dr. Dua or by me, where the media has shown that the patient has come and given a jadoo ki jhappi to the doctor, that you have done wonderful. So we are always there to criticize. We are there to pinpoint one mistake, but we are never there when we save lives. So I think we have to we have to show more of gratitude to our fellow doctors, to our colleagues, to the society, and the reciprocation has to be 100%. Once this reciprocation is there, then our society will have less of anguish, less of frustration. They will be more open to the understanding by the doctor. And moreover, I would say that this is mutual. Fortunately, India healthcare, we have my friends, parents who are admitted with COVID. My friends sitting in New York tell me that the treatment given at Max Hospital, Saket, or in any of the corporate sector is far better, far New York, or maybe in Wisconsin. We are able to save life of patient of 80 years. I think good counseling with the patient. Always speak to your patient, whatever may be, is it good or bad. More and more counseling and more discussion is going to build that trust. And I would say to all my fellow colleagues, seniors, that I have realized that being truthful to your patient and the family is going to build this trust. That's it. Thank you.
And thank you so much. Communication is the key between the doctor and patient also. That's an important aspect, and I think everyone has highlighted over the last 2-3 days as well. And I'm happy that at least there is one thing everyone is kind of anonymous to say, that there has to be more communication between these two. Dr. Dua, your last remark on this.
So, Kamalji, I deal in pediatric cancers. So when I say pediatric cancers, we do lose patients. So nobody can deny in this world that pediatric oncology, you have 100% cure rates. So we do see patients, we do see cancers in which there is a 90% cure rates. There are cancers in which there are 40% cure rates. So it's very important to counsel these families, and we do multiple sessions before we start the therapy, and we tell them that you have to see the field side of the class. If you see the empty side of the class, you would not be able to go up with the therapy. And this is very, very important for the families, for the caregivers to understand that it cannot be 100%. The doctor can try his level best. He can give his 100%, but you cannot foresee the future. Your path should be correct. Whether you will be able to reach to the destination, nobody knows. And that's what we tell the families. Majority of them do understand. But yes, we do face problems, and if that happens, we try to tackle that at that point.
Thank you so much, all three of you, and wonderful, and I'm really grateful for Dr. Dua and Dr. Sumit to bring those patients also. And this gratitude week would not have been complete without hearing the real stories from patients also, who have really gone through that life-saving, life-transforming experiences. And thank you so much for also highlighting that when it comes to the medical professional, where all of you are doing wonderful job, along with the care, concern, and courtesy or compassion, communication has also become an important aspect. And I believe that you are doing all that possible to ensure that the right care is going to your patients and your anyone who is coming with suffering to you.